Okay.
Okay.
Nice.
So just to kind of give our segue here for the recording purposes, we're going to start by doing an energy balancing exercise, which we'll hopefully be able to explain later in the presentation, but we are hoping will be a good experience for each of you and something that you might be able to take home or keep home with you that you do each morning.
Steve, sorry, Dr. Roberts, I'll never get used to that. Do you want me to give any explanation or just do the routine to start? Or
let's just do the routine to start,
okay.
and maybe we'll we might have some questions, and we might call back to this and maybe try and explain some of it a little bit later. But obviously, this is a very big conversation. It would take more than an hour to explain all the aspects of what you're going to do. And so I'd like anyone who's participating maybe to follow along and try and do this on your own.
Yeah. And most of the moves you can do either sitting or standing. I'm going to stand just so you can see what I'm doing with my body. But just to clarify, the daily energy routine is adaptable to different people's energy. So there are different things we can add in. So I'm just going to give you a sampling of a type of daily energy routine that someone could do that touches on a lot of the basic energies. So I'm going to move my chair out of the way. Okay. I like to start my routine every day with 4 thumps. And so I'm going to get close to the camera so you can see. And you don't want to hit too hard, but you do want to hit hard enough that you actually are creating a vibration right up here. And this is actually on your stomach meridian. So you just want to keep thumping on here. About 30 seconds is a good rule of thumb, but sometimes I do it until I actually feel myself yawn, because my energy is kind of trained now that when I start to tap, I start to relax, and then I'll have some of those relaxed responses like a yawn, or I can actually feel my breath starting to deepen. And then the next one is right underneath the clavicle. We're going to thump here. For those who know meridians, this is your kidney points. And this helps you to kind of get your energy flowing and going. And you want to thump according to what your rhythm is. So some people, like to thump faster, and like I'm looking at my brother right now, and he's a slow thumper, and that's totally fitting for him. Okay. And then the next thump is right here. We call this the thymus thump, and it's basically right in the middle of your sternum. I think that's about where it would be, because you're creating a vibration. You don't really have to get exact points. It's okay. And then the 4th thump is here. This is on your spleen points. It's almost like you're hitting like you're like a monkey. That's how I would describe it. And you can kind of come all the way.
My fat gets in the way.
Yeah, no, it doesn't even matter, because you're just creating a vibration. Yeah. And you can come all the way around too along this line.
Fat vibrates. Yes, I get jiggles.
Yeah, no, the jiggle's good. The jiggle gets energy going. All right, so the next one we're going to be taking, you kind of want to give yourself a squeeze on the opposite shoulder from your arm. Give it a good squeeze, and you're pulling the energy down and over across the body, and you kind of brush it off of your hip. And then you go to the other side, you squeeze, you pull it down off the side, and you do this a couple times because you're trying to get the energy to cross over. We want our energy to be crossing over our body. Sometimes you might get the chills a little bit when you start to get the energy flowing. It feels really nice.
So this would be something good you could do in the shower.
Absolutely. I actually do my routine in the shower most often. That's what I do. You might as well kill 2 birds with 1 stone, and you're getting some of the tapping just from the water.
Yep.
So this next one, you're taking the opposite hand, and this is it's called the cross crawl. And then I like to add a little, you see my arms, I'm adding a figure 8 to it. And then eventually you want to add your breath to it, where you're going to breathe in through your mouth. And as you're blowing out, you want to kind of make sure your belly's expanding and getting more relaxed as you do this. Okay, so the next move is called Heaven and Earth. And you want to start, you rub your hands together. And there are some reasons why we do this that we might get into later. You shake it off. You start on your thighs. You back up a little bit. And you want to bend a little. And as you bend, you want to breathe in through your nose. And as you breathe out, you bring your arms up. And then you're going to breathe in and bend again. And you're going to split. This is called heaven and earth. You're going to split your arms, one to the heavens and one to the earth. And you want to actually stretch in both directions. And then you want to come in, bend, and you want to go the opposite side. And after you've done this a couple times, it feels so good to stretch in opposite directions. You come into center and then you bend forward. Like if you've ever done yoga, it's like a forward fold. And you kind of dangle your hands on the ground. You breathe in 3 times. And on the third breath, you want to come up. Then expel the breath when you come into center. Okay, the next one we're going to do is called the Celtic weave. So you're going to start the same way, where you brush your arms, shake it off. Then you want to put it on either side of your ears. If you're someone who's kinesthetically inclined, you might actually feel a little bit of a pulsation here. And then you want to breathe in. And when you breathe out, you're actually going to be weaving figure 8s in front of your body, all the way down. You want to kind of use your breath work with this. And when you get to the bottom, you're actually going to take your arms like this and scoop up energy and then let it drop in figure 8s all around you. And there's lots of variations to that one. The next one is called the belt flow. So you're going to take your arms, going to grab basically behind your belly button. There's a point called the Ming Men point. It's just a really important point in energetic medicine. And you're going to put your hand about there, and you just want to pull energy across your center part of your body. You're pulling it over your belly, basically. And then you want to go down the opposite leg and off the big toe and shake it. And then you can come up the big toe on the inside of your leg, give your spleen a little bit of a figure 8. And then you're going to do the opposite side now. You pull the energy across. To me, it feels good to actually really pull. And then down, off your big toe, come back up, give yourself a nice little figure 8. All right, and so this last one, well, we got the zip up. So you're gonna take your hands and kind of cross them in front of your body. Zip up the center line, blow it out. If you can feel tension, you wanna zip the tension up with your body and release it. And on the last one, you want to end with a figure 8 right underneath your nose. And so this last one here, this is odd, but you're going to take your middle finger and stick it in your belly button and pull up. With your other hand, middle finger, you're going to push up on this point here in the center of your eyebrows, which we call the third eye. And you're going to push up on both of those. And you want to do probably 3 to 4 deep breaths until you feel almost like a relaxation. And again, I tend to yawn. When I yawn, I know I'm done. I know I'm hooked up. So then you can just end with some nice figure 8s, whatever you're feeling. And there's lots of variations to that. And when you know how to do it, it goes very fast. Like I said, I do it in the shower, it takes less than 5 minutes. And I add in what I need for my body that day. All right, Steve.
All right, thank you for taking us through that. I'm sure there's at least a few people that are wondering, what have I signed on for today? And what was that we just did? Some of you might just feel relaxed. Some of you may not have felt much. And some of you may have noticed that 1 or 2 of those exercises in particular may have seemed to have affected you deeper. There's a lot that we could discuss specifically on Eden Energy Medicine. We're only going to have a little time to cover it later in the program today. But Amy is actually starting to see people in the office later hours, some different hours. And she has a website if you want to tell them what your website is, Amy, that they can look up?
Yes, it's Redbird and Rabbit em.com.
Okay.
So Redbird and Rabbit em.com.
Right. And so if you were hoping to do like a one-on-one 45 or 60-minute session where you might balance different aspects of either meridian system, chakra system, auric fields, or different levels of the body, that is something she's offering. And so if you're looking to try and get a massage for your energy system or try to get rebalanced on things that might be recurring patterns for you each day, it might be worth exploring in the future. So, all right, thanks for getting us all grounded, Amy. I think we'll be ready to move on with the program and be able to explain what we're doing here next.
All right. So,
You're muted, Pat.
I think I'm unmuted now. Can you hear me?
Yes.
Okay. So I think that, somebody said to me, oh, I don't believe in that stuff. And I went, interesting. Well, Deepak Chopra, who is quite world famous, has been talking about our biofield reaching 8 feet out on either side of you, and that this round field of energy is interacting with everyone around you. And that's part of the reason I think we've had such a catastrophic effect on our overall health over the past 2 years, because we've removed the ability for people's energy fields to actually build ours, integrate with ours, and strengthen ours. You can't build a complex energy system in isolation if you put somebody in isolation. And I went to shopping probably the first or second time in 2.5, close to 3 years. And my husband said to me, he said, I think everyone at that store would keep us there all afternoon just to talk with us. They were so excited to have somebody coming in and listening to their story, from the woman from Iran who was, so excited about what was going on and the women getting liberated, to the fellow that was, selling a block to put the knives in, telling us all about it. So your energy clearly comes from interacting with other people. And we're going to go back to our PowerPoint this evening. And so should I move on? The vital force?
No, was there a slide before this?
I'll go back one. Biophysics.
Yeah.
It really is quantum physics applied to biofields.
Yes. And it's basically, the idea behind this is that we have magnetic fields that the squig manometer has measured up to 22 feet now, out from the human body, generating from the heart, and our
what
brain
do you call
generates.
it, a squid?
Squid. It's I can't remember what the SQUID stands for, but it's a magnetic field measuring instrument that they do at some of the prestigious universities around here, in their physics labs. But we know that there are different types of forces. It's not just magnetism, it's not just electric fields, and they're all involved with keeping us healthy, keeping things well regulated in our bodies, in balance. But as you just noted, Pat, they also help us communicate with others. Other biofields from another person that pass through ours interact with us, and they can influence us in different ways. And so there really is something to having a feeling and a vibe when you get in a room, right? You may not recognize it consciously, but on a subconscious level, these things are there. Now, there are different types of biofields, as I mentioned. Some of them are probably a little bit more accepted than others because we have an easy way to measure them. And these are things like electric fields. We know along the meridians in the acupuncture TCM system that there's actually a different electric current that runs, that we can actually measure with a voltmeter. Some of these things are like with the lens that we'll talk about. These are measuring and assessing brain waves and heart rate variability. There are acoustic fields, which are sound compression waves, and other vibrational fields. And then there are also light photons that can be transmitted to us. But then there's another type of biofield, or there's another whole category of biofields that are not easily measurable by conventional, well-accepted means in the world of physics and or by other conventional standards. And I would refer to these as subtle energy. And maybe one day we'll get better measuring tools. And there are people who try and measure them through other techniques with pendulums and things like that. And it's just hard to know exactly what you're doing in that situation. Now, some of the exercises we just did with Eden Energy Medicine, I think some could be measurable, but some would certainly be subtle energy, meaning that it would be hard to measure with some sort of scientific electrical equipment. But there's indirect evidence that there's something there that's happening physiologically to our bodies. So if we look at a very brief and incomplete history, and we don't have it all on the slide here, but of energy medicine, really before the 1850s, there was a lot of cross-cultural, if you looked at Chinese medicine or Japanese medicine or Ayurveda, the Himalayan tradition, they had terms for energy in the body, like chi or ki or prana, and they were thought to be life forces, and other people might have referred to them as electrodynamic forces in the body. And there are other things that we might read about in Vedic records or different aspects of shamanism that would also suggest that there are energy systems, some of which we are starting to measure and define now, but others that we may not yet be able to measure. And starting in the late 1700s, there was a German physician named Anton Mesmer, who he came up with this idea of animal magnetism. And you may be familiar with the term mesmerize, where hypnotism kind of derives from that. That actually is related to some of the work that Anton Mesmer used to do. But his idea was that all living systems and everything is affected by magnetic fields. And he would use things like different types of metal rods and instruments to try and manipulate them. And so the idea was definitely present in there that a magnetic field, if you can manipulate it, might be one path to address someone's health. And it's not just about the chemicals in the body. Then we could look at the French medical radiesthesiast, Harold Saxton Burr, who was a Yale School of Medicine anatomist, who used to go around all the trees on campus and would measure the voltage around the trees and say that these voltages have to do with their life force, and he called them L fields. That was in the 1940s.
But that's why in Japan, you will actually get prescribed forest bathing.
Well, yes, and that's actually a big part of what we could actually send people home with our prescriptions. But you're getting electrons you're getting electrons donated to your body from the earth when you do that. And this has to do with when we're looking at our bodies, it's not just chemicals, but also electric. But there's also more than electric. But with electric, you need to have electrons in your body. And there is a thought that some people who have chronic disease are actually electron deficient.
So when going out in the garden and putting their hands in dirt and with those squiggly worms and planting, is that a way to transfer the energy from the plant life into their energy? If you know about chlorella and spirulina and algae and what an enormous energy source that is. But people can also take note that in their backyard is the opportunity to engage in energy fields that can donate electrons to them.
Yes. I mean, to say it shortly, yes, we can get electrons from those around us, from the earth. Where being barefoot and getting our hands in the soil will do that. Now, you might need to do it for some time, because most of us are used to wearing rubber-soled shoes that blocks all that electron transfer. If you wore leather shoes or barefoot, you might do a bit better with it. So the last thing I just mentioned about the history was in the 1990s, the NIH, and this is very American-centric. There are people in other countries that have done this work. In the 1990s, the NIH basically had a division all about integrative and alternative medicine. And in that subgroup of that division, there was a whole section on biofields and kind of like, how do we put therapeutic touch, Reiki, distance healing, prayer and spirituality and quantum healing of different types? What do we call that? And how do we uniformly start researching that? And that's where the term biofield got coined by people like Beverly Rubrick and Deepak Chopra. But that's where you see it introduced into the literature if you're going to do scientific literature research and searches on this topic. Let's go ahead and move on from here, just so we can move along the time. I wish we could talk for an hour on this topic because I do love the history of this. And we did comment on this. Now, if there are biofields and we can measure some of them and not measure some others, and we can actually do things to manipulate them, Well, we could actually do that in ways that are harmful to health, and we can do that in ways where we can almost harness a therapeutic power or energy. And that's really what we're after here when we're talking about trying to address your overall health and well-being.
Well, there isn't a parent alive that hasn't said, I knew something was wrong. And even, my children, my daughter, when I was in the emergency room with my blood pressure, she called me up from California and said, I've been up all night. And I'm like, well, you certainly knew before I did. And she's like, where are you? I thought I was having a heart attack. I go, well, thank you for the sympathy vote, but I'll take that pass for you, and you can go back to sleep. But she knew all night, which was really amazing. So I think that Carl Jung talked about this a lot, and that is the ability for thought and the body to spend time in an energy field that connects across many, many, many miles. In my daughter's case, a couple of thousand miles. And I think that harnessing yourself into being open to that energy. How do we get there? We talk about sleep, we talk about exercise, what are the things that we can do on our own, and what are the things that might be available? And that's what we've all been looking at in our practice, which is how can we bring energy to you in a way that, ups the ante for you, that you can find your energy levels coming up, and which is why we've been doing brain tap, measuring your heart rate variability, looking at your vagus nerve, and all of these small modules of improving your health, connecting them, and then nirvana, I feel great. I've finally conquered my neural Lyme or my concussion or my inflammatory process. So these are the things that we're applying them to within our practice.
I would just add that another way to bring up your energy, which is always one of my most favorite topics, is through your food choices. If you think about eating a predominantly plant-based diet, what are plants except minerals from the soil, the air, the influence of the sun and the moon, right? So when you eat real food, you bring more than nutrients into your body, you bring the essence of the energy of nature. And that's why food is one of the most powerful ways that you can build your energy.
So how do we communicate within ourselves and with others, which harkens back to a little Carl Jung moment I had a second ago, but consciousness, language spoken and written, body language, and intention. Steve, what do you think about the subconscious?
Well, yeah, I think we're probably sending messages to each other that we don't realize that are actually impacting how the health and well-being and how our own bodies are regulating. And, we subconsciously do body language with what we're thinking, even if you don't say it out loud, it can potentially lead to negative feelings or positive feelings in an atmosphere or in a room. You may not be aware, but you're breathing out little bits of genetic code and RNA all the time that the neighbor next to you is breathing in. And so when you have a different behavior, your body transcribes a different amount of RNA, or if you go through a walk in the woods, the trees do it. The trees actually emit microRNA that you then breathe in, and it can have a modulating effect on your own body and your own experience. And so these are all things that you might not think about, but they're happening every day.
So let's go on to our next slide. Somebody had a question that they feel that they're in their energy field, they've been prone to knocking out batteries and watches, and I guess they can even turn off a street light. So wondering, are they seeking electrons or emitting too many electrons?
That would be a good question. In that situation, to be honest, I'd probably refer you to Amy and have her do an energy assessment on you.
Right. Let's look at all your energy fields. But, I do want to move it not only from the Oriental medicine, traditional or Ayurvedic or
the cultural ancient wisdom knowledge space.
Wisdom, but really, why do we need it in our contemporary time, and how would Western medicine look at it? Well, cells, I always have this fantasy that we're all part of a larger cell. We're a cell within a cell within a cell, kind of like if you were looking down a string of mirrors, and our cells are small universes. And when those universe, they're like constellations. They have organelles, they have energy transfer, they make energy, they use oxygen, they create free radicals, and then they get into oxidative stress. So I want you to think about some of what we're talking about really applies at the cellular level to change from the oxidative stress and bring it back into harmony. And that's why we're looking at these therapies within our practice. I'm just going to go to the next slide. There we go. So Steve, take it away.
Yeah, so this is actually, of all the areas in bio and energy medicine, we could talk about any of them for like an hour, but there's one I really wanted to highlight, and that's this work with biophotons, which I just absolutely find fascinating. And this is the idea that all humans actually we make and emit light, but at a very, very, very low level, and it can actually be measured with scientific equipment. And you might think of it as like we're all like just mini fireflies or something like that, but it's actually a little bit different than that. They were first discovered about 100 years ago, the light that we emit, by Alexander Gurevich. And the modern view by most people is that the light that we're emitting, this very low level light that you can't actually see but could be measured with equipment, is just a byproduct of chemical reactions in the body, like bioluminescence in a firefly, or some are like glowworms, or some of these other insects or things in the sea in Puerto Rico that you can see in the water down there. But there are other biofield theorists who really challenge this idea that it's just a junk byproduct, and that there's something much more going on with biophoton emission, or ultra weak light emission, as you might see it in the literature, because it actually has some behavior that's different from bioluminescent chemicals. As people near their death, bioluminescence decreases because your chemical structure is not as robust, but biophotons actually increase if you measure them. And what we're actually finding, Beverly Rubrick, again, that person who was in the NIH group that coined the term biofield, she's now working for the Institute of Frontier Science, and she has a lab where they've set up this really dark room where they've been able to shield it from magnetism and from electric fields, and they've really tried to isolate like it's totally pitch black. And they put this device here that measures the photons that are output, and they expose people to certain stimuli or certain chemicals or certain things, and they watch what happens at different parts of the body. And it's actually fascinating because it's actually confirming some of this ancient knowledge and wisdom Pat was talking about. And you may have noticed in Amy's exercise that she had us do at the beginning, she was having us use certain fingers. But what they've actually been able to show in the research here is that there are more biophotons that are emitted from the face, from the palms of the hands, from the area that we refer to as the glabella, or the third eye region. There are certain fingers actually that emit more biophotons than other fingers. And it's an absolutely fascinating thing to me that some people, when they do energy medicine from cultural traditions, or what you might see in energy medicine, they actually do focus very much on using certain fingers, like assembled together. They put them on certain points of the body. And part of me has to wonder if we're really actually manipulating the biophoton energy and biophoton transfer, which is a bidirectional communication system, that it may not be all of what's there, but I've got to think that there's at least part of that going on when I look at the research that she's doing.
So, there are a lot of these instances of shamans and healing. When I was in Peru, our guide was a shaman, and he talked about how they would take guinea pigs and put them on the body, and the guinea pig would settle over the organ that was affected or where the tumor was. The guinea pig always knew where to go. And I actually had a friend, she was quite sick with a urinary tract infection. And every time she'd come into the room, the dog would jump up and put his head right where her bladder was. And no matter what she did, he wouldn't keep coming at her bladder. The animal kingdom, I think, works probably within the biophoton communication. That's what they have. What makes us human is we have consciousness with the understanding of death. I wonder if animals know that there's an end, except when they're getting attacked. But that's one of the defining points of maybe humanism, is we actually know there is an end. They get surprised by the end. But certainly animals and dogs, we've all witnessed somebody coming home from the hospital and their cat or their dog staying right on the knee that was replaced or on the leg that was damaged or on the side of the stroke, and their animal forces to communicate back to their caretaker, their partner in life.
Yeah.
So why do we get imbalance? That's what we're
Well,
here to fix.
yeah, this one is actually, this is a theoretical, but I actually think it's the axiom that I work by in some of the work that I do. And I think the idea that someone who was going to pursue subtle energy biofield work would probably want to think about, and even the measurable biofield work. When we do like electric testing, or if you do an energy medicine assessment, we can't like diagnose people with some medical condition. We can find an imbalance. And the idea behind this is that before physical disease might manifest, there's probably an imbalance in the biofields. And so you might be able to head off or prevent disease by addressing the biofield early. And how are you going to prove that? Well, you're not. You're just going to be able to say, well, you're not going to get this thing. And I think conventional people or people who are skeptical would say, well, I might not have gotten it anyway. And maybe that's true. But to me, it also brings up an idea that once you've gotten the point where you have physical and chronic disease, we can focus on doing all these physical things with drugs and supplements and even herbs to some extent. But if you also don't address concurrently the biofield, you may not have enough of the supporting electrical, magnetic, and other support forces in place for the physical healing to be sustained and lasting. And so I do think it's another aspect of our health we want to be looking at.
So one thing that is certainly, going down a new patient comes in and knowing nothing about them. The most important thing for me is to have a sense of how they rank their wellness. Like, where was that moment that you felt the best you were? And what was the history that took place to where you are now? And is it sleep that disrupted you? Was it trauma? Everyone has trauma. It could be a physical trauma. It could be emotional trauma. It could be parental trauma. It could be sibling trauma. Your sibling might be driving you crazy. And maybe you are the best match in siblings and you had to grow up with this person that was always out of sync with your biofields. These all can play out in how your wellness shapes itself or your illness shapes itself as you go through the decades of your life. And that's what I have found most helpful with patients. And even, like I said to somebody today, we need to reset. I need to look at you all over again and sit here and listen to you and let that story start to open up the door to understanding, when did the imbalance take place and how can we bring it back in order or in harmony? And I think we live in such a challenging contemporary life. And I don't want anyone to think that being hungry and freezing 99% of the time, which is basically only 200 years ago, which is, I guess, in the clock view of humanity, just that was like an eighth of a second ago, that life was hard. Food, you were on the hunt for food. If you've ever gone hunting, 99.9% boredom and 1%, oh my God. And you had to bring the food back for your family, your tribe. And whether you were a victim to the weather, you were at the mercy of other elements, animals, bears, tigers, lions, and bears. So we live in a pretty amazing time, but how do we make the best of the time that we live in? So here are some of the things that we've been talking about that we can start bringing to you as our cohorts in this path to wellness. I don't know who would like to take EMF hygiene tools, I guess.
Well, Steve can take that one. And then Pat, switch over to me as host because I
Yep.
have more updated slides.
Okay.
Yeah, so I think what we're talking about here is, what are we doing at the office and with Genius of Wellness, with all the service offerings we have that can help you address your biofield and not just the physical chemistry of the body that you get at a typical medical office. The first thing, the EMF hygiene tools, this is what we were getting at, that not everything, and in fact, Robert Becker really drew attention to it in his book, The Electric Body, that there was some concern. The electric body.
The electric body.
Yeah.
Just for people that want to do some light reading tonight.
Yeah. I mean, he brought some, starting from the 70s and even onward, they really started highlighting that all these man-made frequencies that we have now with cell phone towers and various different things, they're affecting our biofields. And I don't know how much thought was put into making sure that they're affecting our biofields positively. And so a lot of us would probably benefit from understanding that it might not be a good idea to sleep right next to your Wi-Fi router, or to even have it on at all at night when you're sleeping. Or should I really be holding a cell phone up to my head all the time? Or does that potentially invite some damage to my biofield in some way? And so we do actually have some meters that we have at the office where you can try and assess some of this according to building biology practices, where they've actually set standards of what would be considered electromagnetic radiation in a home, whether it's from your electric lines, the high power lines, overhead, or transformers that might be near your home, or your neighbor's Wi-Fi router that's sending signals constantly through the wall. And if where you're sleeping might not be the healthiest sleep environment for you to be in, you're there 8 hours a day, every day, and if it's getting high levels of these things, it might contribute to some chronic disease down the road here. And so one of our things is, let's try and build our capacity to avoid negative exposures to some of these biofield altering things that are out there in our environment now.
I actually saw a picture of the Washington, DC mall, and it was a representation of all of the wavelengths Wi-Fi going across the mall. And essentially you're walking through, we're like in a microwave most of the time.
Yeah.
And having just been in Washington, DC, yesterday I got back we're looking at colleges for my daughter there. At one of the colleges we looked at, there was a cell phone tower literally within 150 feet of the freshman dorms.
Yeah.
I mean, it's staggering how little appreciation we have for, just because we can't see the waves, it doesn't mean they aren't there. And just because we can't see our biofield, it doesn't mean it's not being affected by these other less beneficial waves that are constantly circulating around us.
Yeah, and we have actually some other material that you can find on the website. We did a podcast with Cece Doucette, where we could really refer, again, we could have spent this whole thing on, negative, effects of EMF and hygiene and electromagnetic radiation and hygiene practices. But I think we want to probably leave that there for now and focus on the things we're doing to try and positively affect the biofield and improve it with the different modalities and therapies and different aspects of different subtypes of biofields, whether it's electric, electromagnetic, light photobiomodulation, acoustic and cymatic sound waves. So why don't we move on from there?
So some of the
You're gonna have to switch over to me for your slides.
What am I doing?
If you make me the host.
I did.
Oh, okay. So let me
You
share.
should be the host. So I
Hold
could
on.
stop share and see if you can bring up do you have the PowerPoint up?
Should be here.
Okay. So while Leslie's bringing up the slide, what we started looking at was some of the therapies that we could bring and make accessible, which would provide you with the offset to the contemporary world where we have no control, 5G, 3G, 4G, whatever, that's going to be all around us. But how do you offset it? So we've been really looking at cold laser. So is this the slide we're going to start with?
Yeah. And
Okay.
I'll talk a little bit about cold laser, but I don't want to spend too much time on cold laser because you can go back to P. Hopkins MD, Get Smart, and we've done webinars and town halls on cold laser. But I'll just say that We started the cold laser. We bought a cold laser, which literally is what you see right here. It fits in the size in the palm of your hand. It looks like a little flashlight for anyone who hasn't experienced it at the practice. We got it 3 years ago thinking, oh, we're just going to laser some swollen joints. We have plenty of those in a rheumatology practice. But what we found 3.5 years into owning a cold laser is there are applications way beyond reducing joint inflammation. In the slide, it talks a little bit about research done in Brazil to use a cold laser to actually re-regulate the thyroid gland. Also using a cold laser to reduce cytokines or reduce inflammatory markers in the body. And our applications of the cold laser have gone way beyond what we thought when we bought it 3 years ago. We've had a lot of good results with wound and scar healing. I actually just saw someone today who had an older woman who had a very large leg wound, and she came in last week and it was lasered. And she came in today and said, my visiting nurse could not believe how much my wound improved after one laser treatment. So reducing scars, healing wounds, dealing with irritable bowel, calming down guts that are dysfunctional, the musculoskeletal issues that we thought we would use a laser for have been, certainly very successful, but we've also done things like shingles. And recently through COVID, we've really seen applications of the laser for respiratory issues and the power of the laser to decrease inflammation in the lungs, to literally address fibrotic lung tissue. And we've really, probably 50% of the lasering I'm doing right now is related to respiratory issues, everything from chronic sinusitis and long haul COVID to asbestosis. So the applications have really grown, and this is one that Dr. Hopkins is starting now to use the laser in combination with stem cells and PRP. I'll let you talk a little bit about that, Pat.
Sure. Again, combining, and I hope I'm not echoing, let me put down my volume a little bit. So when I talk about stem cells, we have brought in platelet-rich plasma, which many of you have, I'm sure, heard of. The orthopedic community is very gung-ho on both stem cells, which stem cells in a product line is not, while quite expensive, can run up to $5,000 for an injection, has not been proven to regenerate cartilage. So we made the decision not to become stem cell provider and service center, but rather to look at platelet-rich plasma, where we take your blood, spin it down, take off that buffy coat where we know all the platelets are. And the platelets are just these little super packages of growth hormone and ability to modulate into repair mechanisms within the joint. So my daughter, who at 18 had a knee injury requiring a tendon transplant, she ruptured her anterior cruciate ligament, and now 20 years later at 39, she's in chronic pain. And I said, all right, let's do this. Let's try the platelet-rich plasma. She doesn't want a knee replacement, but she's losing cartilage. And she said, I'm just in pain all the time if I do anything. And she has 3 little kids. And so we brought her in, we did the lasered her knee, then we did the platelet-rich plasma, and then relasered the knee afterwards, each segment about 10 minutes of laser. And yesterday she's 6 to 7 weeks out from her treatment, and her pain is 20% of what it was prior to the treatment. Playing tennis, running after her kids, biking with her children, doing her.
She really had 80% improvement.
She's had 80% improvement.
Right.
She
I'm going to keep moving
her
here.
mother was responsible for it, but I did let her know her mother is responsible for her 80% improvement. So, I mean, it was just really pretty amazing. We've also, many of you have had the benefits of renting our Beamer mat to take home. And I do recommend we rent it for 1 to 3 months. We keep it as affordable as we can so that you can really get the benefit of the pulsed electromagnetic fields. How does that work? Well, it increases the blood flow, capillary blood flow, so through your superficial, your skin is your major organ. And with that, you're increasing the nitric oxide in all of your cells. And with that, hopefully you're offsetting some of the effects of the Wi-Fi that may be around you, the 5G, your Wi-Fi. You know, when I open my phone, I live in an apartment. It's probably 20 people whose, you know, Wi-Fi's I could go on if I knew their passcode. So this is something that athletes have been using. All of your Triple Crown winners in the veterinary community are all Beamer pulsed electromagnetic field users. Repair of cells. So we have a strap that we can increase the pulsations through the joints. So we've been doing that with patients, and then adding the laser on top. So you're really getting, people are saying after we're lasering them and using the Beamer, they're like, I actually felt the ground for the first time. Their peripheral neuropathies are improving. I know, Steve, do you have any words about electromagnetic field therapy?
Yeah, so probably the best known place in the conventional literature for this is with orthopedic surgery where there's been a non-union fracture. And then there's evidence that PEMF definitely helps with this. There are some other adjacent magnetic field therapies like RTMS for neurologic, anxiety, depression, mental health related issues. But that is slightly different. The Beamer, I think, has been a very successful in terms of getting a greater reach to other people. And I actually think that there are other EMF devices out there, electromagnetic devices that even have stronger magnets. I would love for us to expand in that direction in the future. But as you mentioned, Pat, we've already got a lot of people who even with, you know,
people bring
Beamer,
it back and go, all the swelling's out of my legs. So their lymphedema is going. And you know, the lymphatic system is tied and connected directly. People tell me, gee, you know, I'm more flexible. I feel like, so one of the my neighbors on Cape Cod, I have him doing the Beamer and the brain tap, which we'll talk a little bit about. And he won the club championship shooting. He shot a 65. So he's 7 under par now. I said, I don't dare make you any better at what you're doing. But, you know, he's noticed a tremendous improvement, and he was really suffering, I think, with, you know, he'd call me up and go, I just don't feel right. And I think he was exposed to a lot of damaging energy fields within the electronic systems that he was exposed to. He has a history of a brain tumor, and it was benign but growing. So he had 2 18-hour surgeries. And, you know, at 49 now, he's like, I'm in the best shape of my life. And we've been, you know, basically working together over the last 2 or 3 years. When we got his gut under control, he finally got a Beamer to use at home. I have one. I sleep 4 hours a night, 2 hours going to bed, sleep. I have it on my night program and 2 hours before I get up. And people always say, how do you have so much energy at your advanced age? And I say, well, ashwagandha, Beamer, and I brain tap all the time. So and now we'll get on to some Eden energy, which I don't know, Amy, would you, for people that are familiar with Reiki practitioners, is this somewhat in that line or very different, or how would you relate it to any of the other energy practices?
Yeah, I mean, Eden energy medicine draws from a lot of different traditions. So there are some aspects of it. We work with 9 different energy systems. And so some of it might seem like Reiki if someone's done it before, because we do work in the field because, you know, your hands are magnetic. So we use our hands in various ways to shift and pull energy in the field. But then there's also a lot of influence from things like acupressure, acupuncture. So we use actual physical touch where we're bringing points into balance, where we're physically touching the body. Some of it might seem like massage because you're actually pulling energy from different parts of the body or places that are stuck or places where the energy flow has gotten dysregulated, and you're pulling that energy over. So it might feel like massage to someone. But then there's also some of that tapping work. If anyone's familiar with EFT or any sort of like AIT or temporal lobe tapping, that is also part of Eden energy medicine. So it's kind of this really interesting school of thought where Donna Eden has, taken this influence, but she sees energy in her own particular way. She's developed techniques that kind of draw from these different things, and then she adds her own spin to it. So it's kind of a mashup of a lot of different kind of energy systems, which is what spoke to me about it. Because I feel like when I'm working with someone, if something, like if something isn't going quite right, there's all these other tools and techniques that I can actually go to, because you're not really limited to any one particular modality when you're working with it.
So
I
Amy,
want,
would you be interested, maybe we have a class at the office sometime where you
Yeah.
can kind of bring people and teach them the daily energy routine, and then
Absolutely.
demonstrate we'll do it in a blind draw. So we'll
Yeah.
get to pick one lucky person. But getting back to tapping and the energy in the room, when Steve was working with Leslie and they were doing the family emotional tree, and we've had Karen Paolini, who's worked with our patients in group therapy sessions to do a spiritual journey. And as one patient said, at the end of it, we all had the exact same image in our mind. So
Oh, wow.
the collective group, and maybe Steve or Leslie can talk a little bit about the sessions. And I think now that we feel like COVID is kind of over, maybe we can bring that back if people are interested.
Yeah,
yeah, I think it
absolutely.
would be nice to explore that. And maybe we can lead it off with Amy coming to the office to, do some demonstrations in person of Eden energy medicine and give people a little bit more information about her services, which we'll be incorporating at Hopkins Medical Group.
And Steve, do you want to talk? Well, we'll go on to, well, right now, all right.
I want to keep us moving as well.
Keep us moving. I know our time is going. So along with all of this, I really felt that there were so many people who were blocked in their passage to wellness. They couldn't engage in getting well. It was as if no matter what we did, there was a door closed. And the more I read about the deep brain, the hippocampus and the amygdala, and how do we get trauma to be resettled in our deep brain, so it's not forcing you into the path of unwellness, but rather engaging you and your deep brain in the autonomic nervous system to heal. And that brought me to the work of Leonard Oakes, which he's my contemporary, and he started this work in the 80s. And Steve Larson and his wife really became the proponents and the expanders of low energy neurofeedback. And if you look at neurofeedback systems, there can be a lot of active engagement with the patient or person, client, whatever, who is engaged in how do I make my brain do this? And I've done a lot of different neurofeedback systems, and I found it difficult to stay attached to it, which is why I ended up marching down the field of brain tap. And many of you in the office I've given you a 20-minute brain exploration rest. In 20 minutes, you get your 5 hours of sleep, but also using the low energy neurofeedback. So this sends micro signals back into the brain where we see disorganization, or you're not using your whole brain, which most of us are not. There's a fair amount of it that's either suppressed or can't outweigh the parts of the brain that are overriding. We have one patient who she's had surgery on her brain, on her inner ear, and her inner ear bounces up against her temporal lobes. And I'm telling you, I did mapped her whole brain, and I'm like, there it is. Wow. There it is, and right on the paper what you feel. And it's very difficult for you to tell people what you feel is that these two pieces of your head, your temporal lobes, are just exploding, which you can see. And what we're trying to do is retrain the other part of the brain to get active so that damps down. And this is wonderful to be used in anything where you want your brain better. I don't care if it's a dementia, memory, concussion, anxiety,
Or just a
George-
student wanting to be more focused at
Focus.
school.
you know, and you
Right?
don't want
You
to
don't
rely
have to
on
have a
Adderall or Ritalin.
diagnosis.
Right. So Ned Hallowell, who wrote the book Driven to Distraction, has really been a proponent of low energy neurofeedback as an alternative to starting kids on Ritalin. This is brain tap, which, so I've done brain tap and then done my EEG, and I see that with my brain tap in 20 minutes with my headset on with the lights and the sound, I'm right down into theta wave, healing and super learning. And I've measured that. And wow, if you can get down to healing and super learning, because I want to read 5 articles tonight and absorb at least 20% of them. I'm not like Steve. Well, I used to be like Steve. I used to have a photographic memory, but the camera's a little dull. So if you're getting into that healing and super learning brainwave, think of what your body can start to do, which is rest, digest, and heal and recover. And if you're taking Ativan, you're taking Ambien every night, you're on Lunesta, you're taking Trazodone, you cannot get to delta theta. And that's where your deep sleep recovery and your super learning. So,
And your immunity.
and your immune system. They've actually shown that if you take Ambien like 10 nights in the year, you've shifted your immune system and your ability to survey all your cells, because there are abnormal cells being formed every millisecond, but a robust immune system goes, that guy out of here. You don't get to make a cancer. But if you're not resting, if you're not in delta and theta wave, you're going to be a victim to your lack of sleep. If you want to torture somebody, what they say, keep them awake for 3 days. So then Leslie went down the path of microcurrents. So I'm going to let Leslie talk now about the microcurrents.
Well, Dr. Roberts got us down the path of microcurrents. So in fairness,
Thanks,
I followed Steve down the path of microcurrent, and I'll let him probably explain the technology a little bit better to you. But basically, you are using, again, very low frequencies, very low currents, hence microcurrent, to reset the body. And you can see this patient has the device on their knee. And it's, maybe they had torn cartilage, maybe they had knee surgery, maybe they just have chronic knee pain, but it's this little device that, through attaching electrodes to the skin, sends currents to help reset tissue. And we know that there are certain frequencies that help with inflammation. So we can run a current or a channel that overall sends frequencies through the body that decreases inflammation. And then we can layer on another channel that maybe is specific to the knee. So we're addressing inflammation and we're targeting the knee tissue. So these have traditionally been used to in physical therapy and chiropractic practices to kind of reset muscle tissue, cartilage, ligament. But there are really wider applications for that in terms of just resetting your autonomic nervous system. And, everything that comes with that when you rebalance the sympathetic and parasympathetic systems. Steve, why don't you add to that?
I don't know if I can add much better. You're now the experienced master here in this, Leslie. So no, I mean, I think the things on the slide, for those of you who can see the picture and have experienced it, it looks and feels a little bit like how TENS units might, for people who have used them for chronic pain. But this is not just a chronic pain application, as Leslie highlighted. Just to answer, or at least get at something one of the questions from one of our attendees has asked, this is something that could be used for scar therapy and some of the interference fields that might be there. And we've been using it for people who have surgical scars, actually, along with the laser light therapy with some pretty impressive responses. Now, I don't want to say it's going to work for everyone, but man, I would certainly consider it.
We have one patient who he comes in, he had a very bad car accident, I don't know, 5-7 years ago now, multiple surgeries on his lower leg, skin grafting, bone grafting, you name it. He had probably 5 or 6 surgeries. And when he started coming, he said, my foot feels like every time I put my shoe on, I'm sticking a piece of wood a block of wood into my shoe. I have no feeling, no sensation whatsoever. And not only is his large scar shrinking, but he's beginning to have feeling in his foot again. And the constant pain he had from the scar is now gone. And he's beginning to regenerate his sensation. So again, we don't know. We can never guarantee results. We don't know how much progress a patient will make, but these are non-invasive therapies that have no negative side effects, that are worth utilizing for many of these type of things, such as scars that really don't have a comparable kind of Western treatment to effectively address.
And we've also noticed, we use, Leslie is often using 2 of these program machines so that we can run a program that gets the mind to rest and then gets the whatever maybe we're targeting Lyme. So we're going to shift the landscape so that the spirochete is not in a friendly environment, but rather we can target it, so we can eliminate it. We can target viruses. We can target your connective tissue. And in doing that, we're allowing the elements in your body to start to heal themselves because you're optimizing your natural cellular reaction. Our cells, we weren't designed to be sick. In nature, yes, could you be felled by a tree falling on you? Yes, but human nature, the body, and in nature, we're not designed to be ill. We are dealing with the contemporary impact of a contemporary world. And we always laugh when the program hits certain vibration in someone's body. We'll we know it's right because we can hear them snoring all the way to the other end of the office. Also, we go, look in there. They have no idea. Their mouth is open, the head is back, and they're sound asleep. So between using the brain tap, I mean, if you want a good quick nap in the middle of the day, stop by and you jump on the beamer for 20 minutes and do a brain tap and experience relaxation, which I think is one of the difficult parts of our lives to certainly get a hold of. Now, if anyone has any questions, we welcome questions right now. And Nikola Tesla said, the day science begins to study non-physical phenomenon, it will make more progress in 1 decade than in all the previous centuries of its existence. And we're not going to say it better than that. But I've been catching up on the newest data for people in pain, back pain, spinal stenosis, radiculopathy. So there was a meta-analysis of 2000 to 2018, and they looked at all of the injections, which, by the way, is $385 billion a year is spent on joint pain, back pain. And they found that there was no difference whether you used Marcaine alone or lidocaine or Marcaine with steroids, that the steroids that people are getting injected every day at pain clinics, which ultimately will end up in adrenal suppression if you have enough of them, did not add anything. So I would like to advise anyone who is involved in a pain clinic to request that they get Marcaine. And we've shifted many of our injections over to laser therapy or Marcaine alone. I'm trying to really limit the use of corticosteroids for pain management, but really look at what is setting the pain in place, and can we use not use injections as our only therapeutic modality. I don't know if anyone else would like to add anything at this time, or if there are any questions. We have about 10 minutes left. Everybody good? Well, I want to thank everyone for joining us this evening. This is our first town hall webinar for the year, and we will be focusing on healing and bringing some special guests on in the next couple of months. And we will let you know if we can find a date where in the not too distant future where Amy can come into our office, show us how to get our daily energy flow, and Steve could teach us how to map out our family emotional history. And for a lot of people that won't, well, let's just say it'll be interesting to map out your family history from an emotional standpoint. You know, we think about, oh, well, this one was this tall, and this one had this color eye, and this one had that, and this one had this. We always talk about taking a family history from a disease state, but there's a lot to be gained by looking at the cultural, emotional landscape of our family. So welcome back, everyone. And I just want to thank everyone for being here. And thank you, Amy, for coming on board and teaching us. And we'll let you lead the ending salutation if you want to send everyone home with a couple of moves.
Oh, sure. Absolutely. Thanks for having me. This was great. It was really, I like hearing the lens through which you see it, because it's very similar to energy medicine, but just talking about it in scientific terminology. So I think a good one to do when you're going to bed is a calming one called the triple warmer. So this around your lobe, and you probably do this sometimes when you're stressed out, because I think intuitively we often actually do go toward these pathways. But
So
you want to cover.
Leslie, stop the share so we can see Amy.
Okay.
Amy.
Yeah,
in the
I'm
full
trying to
screen.
do that.
Yeah,
Okay.
there we go. Awesome.
So this is a great one. You kind of, it's called cover your eyes, because obviously you start with covering your eyes. You take a deep breath. You want to pull it over to your lobes, to your like temples. And you want to smooth around your ears. You can kind of hang on your shoulders. This is almost like giving yourself a hug. You come down the meridians on the outside of your arms. You cross over your heart center. And you want to do some really good deep breathing here. I actually like the 4-4-3-6, where you breathe in for 4, hold it for 4, and then breathe out for 6. And on the last one, you can, when you breathe out for 6, you take your arms out and you shake that energy off. So that's a really great one to do every night before bed. You're kind of smoothing around your triple warmer, which is your fight, flight, or freeze. And this is just calming it down. You're going backwards over it. Hang, give yourself a nice hug, heart center. Don't forget to breathe.
I know, I'm watching you holding my breath.
Yeah, you know, I hold my breath all the time. And when I bring consciousness to it, I'm like, why am I holding my breath? You're holding all that energy in your body. It can't function the way it needs to.
Yeah.
It's
All
so
right,
I do
well-
it all the time. Thank you
Well,
so
good
much.
night, everyone. It is my bedtime. So thank you all for being here, and we look forward to you joining us in person in our office now that hopefully our world has opened up back into a somewhat normal space. So thank you, Amy, Leslie, Stephen, and good night all.
Good night.
Yeah.